You've lost teeth, you had lots of gum disease, you've worn dentures, or teeth were taken out a while back and the bone has shriveled away. Now, when you go to have implants, there isn't enough bone to place implants. So in these particular cases, what will happen is that you've had volume loss. So not only have you lost width, you've also lost height. And this now means that it's not possibly safe to place implants because it's close to a nerve or some kind of blood vessel, or there is just not enough height left to be able to place implants, because if we do that, then the teeth are going to be very, very long. So what are your options? In this case, you can have something called a block bone graft done by your implant surgeon. And this can come from two different sources. It can either come from another donor who has had a hip replacement, and then this has been screened and it's been sent on to a donor bank. Or better than that, it can come from you. Now, if it comes from another donor, then that block can either be human or it can be an animal. But either ways, it will take much longer for that to integrate with your jawbone. It has a higher failure rate as well. And then once it's ready, then it can be used to put implants into place. It might take much, much longer. So it could be anything between 9 to 12 months before it's even ready, versus when you take it from you. When we take it from you, this is called an autogenous plate graft. So we don't take a block. We're taking maybe about 2-3 millimeter thickness of plate from the lower jaw. So it could be that you have a defect in the front or somewhere even at the bottom. And we take this thin slither or plate and we basically split this into thinner plates so that we can build a box. This is why it's called a box or block bone graft. And we screw it into place. It's a very gentle procedure. And then over a period of 3 months, it's going to regenerate bone. Because it's from your own body, your body's going to accept it much more readily, and you're going to get a much nicer result as well, because the tissues will be healed around it as if it was your own jaw. And over the 3 months, that bone will then integrate and fuse into your actual jawbone. We will then be in a position to put implants into it. Usually we take it from the lower jaw at the back where it's really thick, so you're not really going to miss it. If it's a large defect, we might need to do it from both sides to rebuild that whole contour of the jaw. Sometimes we might even suggest that we take it from your palate, but in that case it might just be a very small, thin section that we can actually achieve. If we want to achieve bigger areas, then it's usually from the lower angle part of the jaw. What do you need to know in terms of the healing? So after having this procedure, it's very important that you don't rinse around this because it might tear the stitches, and it's important that you don't brush around that area, again for the same reason. When you're having the procedure, if you really want to clean that area with some kind of mouthwash, ozonated mouthwash is really good. You just let it sit there and let the tissue steep in it for a minute, so you can time it and then just spit it out. Don't swish it around. After this, in terms of diet, for the next 2 to 3 weeks, you'll be on a soft diet. So for the first 2 days, you'll be on a cold diet, anything from the fridge. Ideally, this should be ice cream, frozen yogurts, could be smoothies, could be just normal yogurts as long as they're cold, could be cold soup. After 2 days, anything you can squish between your fingers very easily, you can have it. So this could be rice, could be pasta, it could be fruit, it can be seafood, it can be soups, so many things, as long as you can squish it easily. In terms of cleaning, you don't want to go around that area. And then after 3 weeks, going to take the stitches out. The stitches are not dissolving because we want to have control over the healing, so the pressure that we put on the tissue so that it knits together in a nice way. After 3 months, we will scan that area again, and then we will plan your procedure to have implants. Now, this is something that we do in this clinic quite often for a lot of patients, and we do it for other dentists as well because it's quite an advanced procedure. So this is something that we have a lot of experience finding. So even if your implant surgeon might feel that they can't place the implants, we can rebuild the jawbone for them so that they're in a position to be able to do this. If you would like to know more about this, don't hesitate to contact us.